Good morning, everybody, and welcome to AL.com's first part in the series COVID-19 Town Halls, presented by AARP of Alabama. In this 5-part series, we are going to be bringing you an expert panel each week to talk about a certain topic and how coronavirus has infected that topic in our daily lives. I am your host, Ivana Harinkyu, and today I am joined by this panel here. I'm bringing them on screen. I am joined by underneath me on my screen, I have Dr. Karen Lander. She's Assistant State Health Officer with the Alabama Department of Public Health. Dr. Amin Galani, he is a child and adolescent psychiatrist and Mental Health Services Coordinator for Midfield Schools, Camille Underwood. I am also joined by Dr. Claudette Poole. Dr. Claudette Poole is a pediatric infectious disease specialist. She's joining us off camera today in the comments section. And by that, I mean that she is there taking your medical questions about coronavirus and the vaccine. If you have questions like, how long do I need to wait after getting COVID to get vaccinated? Which, by the way, that information's changed a little bit over the years, it feels like years, over the months here since we've learned more. If you have questions like that, or what allergies could maybe make the vaccine unsafe, anything like that, drop them in the comments and Dr. Poole will be there with an answer. All of you today, thank you again for joining me. I know each of you have very busy lives and have a lot going on, especially with COVID. So I've got some really great audience questions I want to get into. But before we do that, I want to take just a minute and ask each of you, how is it going regarding kids and COVID? I know that we are seeing it in the schools. We are seeing it in kids getting COVID at higher rates than what we had seen with the original variant that came up at the end of 2019, beginning of 2020. So Dr. Landers, I'll start with you and just say, how do you think it's going?
I'm certainly very concerned about the number of children ages 0 through 17 that now represent a large proportion of our cases in Alabama. Really about 25% of our cases now are in that age group. And we've gone up to about 3.6% of kids in the 0 to 4. So really, if you look at 5 to 17, you can see that that is really a very significant number of our cases. COVID-19 is not a benign disease in children, and I think we absolutely need to continue to educate about the importance of preventing your child from getting COVID to the extent that you can. Thank you.
Dr. Amin Galani, again, child and adolescent psychiatrist. How do you think it's going regarding kids and COVID and seeing them back in the schools?
Right. So as the previous speaker said, this thing is really concerning. I think last year and a half was very difficult for the kids. And if you look at the CDC's study on the mental health outcomes, they have suggested, or they've found out that with the COVID, kids got really, really affected in terms of their mental health. A lot of kids, their graduation got canceled, their proms got canceled, their sports activities, they were not able to see their kids. A lot of kids kind of went from virtual to in-person to virtual. So they were all stressed out. And then came the summer and people thought that, okay, the next academic year is going to be normal. And as soon as August happened, kids started to go back to school. And every single day I hear at least 40 to 50% of the kids that I see is like either they are have the COVID or they had to drop from the school because somebody from their school had a COVID. So they are losing hope now. They're like, what is going to happen? So it is very concerning, and it is causing a lot of disturbance in their mental health.
Camille, again, you work at Midfield Schools. You are the Mental Health Services Coordinator for the school system there. I know there's several schools in your district. So what are you seeing?
We're seeing a lot of different emotions and reactions to being back in person. Our district stayed virtual for several months. We were only open in person for a couple of months during last school year. And so starting back full-time in person has created some anxiety for some students and to be honest, a lot of faculty and staff as well. But we're focusing on safety first and using all the precautions that we know to. All the students and staff and faculty, we wear masks, wash our hands as often as possible, and use sanitizer. And so we're kind of leaning with the information as it comes, but providing the social and emotional support that's needed to make us all feel safe as much as we can during this pandemic.
Now, I mentioned this earlier. It's worth reiterating. This is going to be a 5-part series. We've got different topics each week. The reason that we started with education is because this has been something that is on everybody's minds. You don't have to be a parent to be worried about this, and you don't have to be a student to be worried about this. School, we know, has started. Some people started early August. Some people have just started in the last few weeks, but it is a topic that is on everybody's minds. Now, I'm going to get into some of these audience questions. Again, if you have a medical question about COVID or the vaccine, feel free to drop them here, and Dr. Poole will help you out there. But some questions that we're going to get into. I have some specifically for some of you, and then some of you, I think, or some of these questions, I think all of you would have a very interesting answer for. So let's get started with one. And Dr. Landers, I'm going to throw this to you first. If anybody, though, Dr. Galani or Camille, if you have a response you want to add, please do. Dr. Landers, this is from Craig. Craig says, "We are a blended family. My wife and I have elected to homeschool one set of kids, but my ex-wife is sending the other kids to in-person school. How do we mitigate the risk of the in-person kids bringing COVID home to us since we're staying at home virtual? How much should we be worried about that, in your opinion?" And he does add that mask mandates are a part of the school district for now, where those kids going in person are attending.
Well, thank you very much for that question, Ivana, and also for that question, Chris. I think a couple of things come into play here. First of all, as we have talked about with adults, certainly, and persons 12 years of age and above, we can cocoon the younger children by being vaccinated. So again, adults 12 years of age, persons 12 years of age and above should be vaccinated against COVID as one way to protect children in the home setting. In addition, and this is something that I would really remind, the mask mandate is in place in the school setting, and I think that is very good because that is a way within the school to reduce transmission. But also keep in mind that kids are only in school 8 hours or so during the day. So when they're out and about in other situations with the alternative parent, then ask that alternative parent to continue to follow mitigation standards with those children, as you would do with your homeschool children when they're out and about in other social situations. So again, vaccinate, carry out your mitigation standards, whether you're in the school setting or whether you're in an indoor setting, otherwise, in order for everyone to stay as safe as possible. Thank you.
It sounds like one thing that you're adding too is this takes a lot of communication between the adults, not only in Craig's situation, but in other situations where maybe you have kids going on play dates or things of that nature. It takes a lot of communication between the different sets of adults to say, look, this is what we believe and this is how we're handling it. How are you handling it?
Absolutely. And again, I think that when you have a blended family situation, certainly we have our mental health professionals here, and that does present circumstances that are a bit special, but we want to remind the children that we as adults are doing all that we can to keep them safe, to keep their life as normal as possible, to be able to continue their education. So I think it goes past our talking about COVID and really encompasses our approach to a cohesive strategy and a cohesive situation for these children. Thank you.
Camille, I know you're in the schools. Are you seeing situations similar to this one that Craig brought up of saying that, certain siblings or half siblings, step siblings, at the end of the day, siblings are some are at home, some are in school, and that there's worry about kids getting each other sick?
Not necessarily that exact scenario, but I just think a lot of the concern just comes from where kids actually go after school. And so the biggest concern, though, is making sure that we're as safe as we possibly can while we're in school, and understanding that those same precautions are necessary once students and families leave the school campuses. So it really varies as far as the concerns, but everyone is just basically concerned about safety first.
Dr. Galani, I have a question for you, and this one came in on Twitter. And The kind of, we'll say, sense of this question was asking why vaccination sites hadn't been set up at different schools across the state where those students qualify for vaccines. So I'm thinking high schools and maybe even at the tail end of junior high, or if you went to school like me, at the tail end of a grammar school that maybe goes up through 8th or 9th grade. So my question for you is, would a situation like that, in your opinion, encourage students to get vaccinated, especially those who maybe have different opinions from their parents or their caregivers at home? Maybe they're in an environment where their adults don't want to get vaccinated, but they might feel differently.
Right. So this is a really, really good question. And I'm glad that you brought this one up. Now, the vaccination, unfortunately, had become very political. It should have not been like that. Now, what's happening lately is I have seen in my patient population and in my friends and families is people are kind of holding to their opinion very, very strongly. And we may have kind of forgotten to talk about and expressing our opinion at the same time respecting where other people are coming from. It seems like people who think that vaccination is must, they are very strong in their opinion, and they're when they're talking maybe disrespecting where other people are coming from. The people who don't want to take the vaccines, they have a very, very strong opinion, and they have their argument. So I think we have forgotten how to talk about these things, how to express our opinions. Now, when it comes to the kids and getting their vaccination, and especially at the setup where they're supposed to take it at the school or other places, I think we should allow the kids to express or even talk about what their opinions are. So, if we are setting it up something like this, I think we should have a group or a setting where kids are allowed to express their opinion, and at the same time, parents have a say on it so that we can talk about it rather than it feels like, oh, you're just giving it or it is just being forced on us. It should not feel that it is being forced on us.
Dr. Landers, is there any sort of paperwork where a guardian or a parent has to approve of I'll say a teenager getting one of these COVID vaccines? We know, again, you could be as young as 13 and go and get a vaccine. You can't drive yourself, probably. We don't have a lot of public transportation in Alabama to get to one of these sites. So what do you think, number one, about kids who are in that situation? And two, is there a protocol that is in place for kids who disagree with their guardians about this?
Sure. Well, again, let me answer the second part of the question first. Certainly in Alabama, and any vaccines that are administered by the Alabama Department of Public Health in our clinics or related even off-site clinics for us, then we do require parental permission for the vaccine in persons that are, again, in the age group that's eligible. Certainly kids 14 and above, we still require parental consent for the vaccine. Kids 12 and above are eligible. But again, we do make sure that all of these kids have parental or guardian permission to take the vaccine. And I think what Dr. Kalani was really saying, if I just might paraphrase, is that we need to respect one another's opinions and help people make health decisions based upon the science, but also be respectful in the way that we do that. So again, we do require parental permission for these vaccines. And I think when children are unfortunately brought into something that is more political than it really should be, that we should, as the first part of the question, have open dialogue and help people to understand, why a person might be reluctant to get the vaccine, and really, again, be able to answer questions. And also remind people, and I've had people say, well, I want to think about it, remind people that they can come back, that they're welcome to think about the vaccine and come back and be vaccinated, but not close the door on the opportunity to vaccinate. And again, in the meantime, I remind people, if you're not going to vaccinate, then please mitigate. Please wear your mask. Please follow the other standards, because, again, we absolutely need to shut this virus down. Thank you.
Camille, how are we talking to kids about vaccines in schools? I know, again, that you work in several different schools in the district, including the high school, where presumably all of these students are at the age range where they are eligible for a COVID-19 vaccine. So how is talking about them in schools going, number one? And number two, and this is also for you, Dr. Galani, how do you talk to kids and teenagers about vaccination?
Okay, well, it's interesting because it's an opportunity to start a conversation about social responsibility as well as self-awareness and also about self-management. And it boils down to a student, especially of age, being able to make a decision in their own best interest. And so that really includes just open discussion, small group discussion about how they feel about the vaccination, misinformation that they may have gotten. And so it really creates a great opportunity to talk about the dynamics and the different competencies of social and emotional learning anyway. And so, it's not certain how many students have agreed to go on and get vaccinated as a result of some of the small group discussions, but it is an opportunity to absolutely stay connected and stay informed about things that impact them on a daily basis.
Dr. Galani, how do you talk to kids, even kids maybe who are too young to be eligible for vaccinations at this point? How do you explain to them what vaccinations for COVID-19 are, especially when they hear, like we've mentioned, all of the political back and forth and all of the arguing about vaccines? How do we explain kind of what the purpose behind these vaccines is?
Right. So I think you brought a really good question, and I'll give you an example. Like my 5-year-old comes and tells me, "Daddy, I'm partially vaccinated." So he doesn't even know what that means. But I think it brought that question in our mind is how do we talk to kids about the vaccinations? So with anything, I think the first step is to kind of sit down together as a family and ask them what do they know about it. So I would start with the conversation saying, so what do you know about COVID vaccine? What have you heard about? What your thoughts and your opinions are? So first understand where the kid stands, how much information they know. So that's number one. And listen to their opinions and every information that they have without interrupting or judging them. Once you heard them completely, then figure it out. If they have the misinformation, where is the source of their misinformation? Where did they got the information from? Help them with the right information from the right source. This right source of information is important. So help them with the facts of what the vaccination is, what it is supposed to do, how safe they are. There are a lot of misconceptions, or a lot of I would say the social media has created this notion of like it is completely unsafe, or they have really bad side effects of which has just not proven right. The OBGYN has came and said that the infertility and other side effects that may have been popularized on the social media, they may not just be right. So help them clarify what are the facts versus misconceptions. And once you have done that, then ask them about their opinion and help understand where they're coming from, and then make a decision as a family what they want to do. And that way they will feel that they got heard and they got clarity, and then they can make informed, healthy decision for their life.
That's a good point. I'm glad you brought that up about social media, because our teenagers are 13, 12, I know is eligible for vaccination, but are kind of 13 through early college age teenagers and Alabamians are really those who are living in this social media world every day. And that is where we see oftentimes this misinformation is spread. So it's a good point to bring it. And while I've got you, Dr. Galani, I'm not gonna give you a water break here. I have a question here from Emily, and she says, which is more harmful in the long run? The mental and emotional toll to children of remote learning and social isolation, or the physical harm of in-person learning and potential COVID exposure?
So that is a really good question, and I've been getting this question for almost a year and a half. Like I started getting these questions when we knew nothing about the COVID. And I think my answer at that time was you have to think about your house situation, your family structure. In your family, if there is somebody with high risk, somebody who has diabetes, somebody who has COPD, do you really want to risk their life? If the answer is no, we don't have anybody in our family who is high risk, then the question becomes what is going to happen to their psychological effect if they have to stay at home and wear masks. Now, dealing with COVID for a year and a half, my answer has changed. And what I've realized after talking to the kids, it depends on the attitude of the kids, of the parents, I'm sorry. If the parent says that, hey, you are staying at home and doing virtual school to save other people, and if you present in that way, I don't think there will be any psychological bad outcome. Instead, you will teach your kids to be more socially responsible. So it's not the negative psychological effect of doing the virtual school or wearing masks, it's how you present to them. If you present to them in a way that, hey, you're doing this to save other people's life, do you want to save other people's life? And once you put it that way, I think they're going to feel proud doing the in-person or in virtual school and wearing a mask if they think they're saving their lives. So that matters how you talk to the kids.
And I'm glad you mentioned that about the masks as well, because it sounds like you would have a similar answer about a parent telling their kid to wear a mask. It's different to say, well, you have to wear a mask because the government told you to wear a mask versus you should wear a mask because you're going to protect that person from getting a disease. Did I put words in your mouth, or is that correct?
No, that's 100% accurate. I think if you say it in a way that, hey, you're young, you're healthy, you will be safe. You may, even if you get the COVID, your symptoms may not be severe enough. You may not die from it. But remember, if you don't wear the mask, you are going to carry the disease and give it to other people who may actually die from it. And I don't think you're a kind of person who want other people to get sick and die. So, do you want to wear masks? And I always say this is instead of telling them what to do, ask them. Ask them, would you like to wear a mask? Because you're going to save life. And you don't even have to tell them the answer. Your kids are going, they're really good kids and they're going to listen to that one and they will wear it. And because they are making a decision, you don't have to remind them multiple times.
You said something there that I think is interesting for a follow-up. And you said that you might be talking to your kid and saying, you should wear your mask or you should do this because of social responsibility. And maybe not necessarily because you would get it and either pass away or be hospitalized. Maybe the chances of that are low. So I got a question on Twitter, Dr. Landers, that I think is perfect for you. And this person kind of jumps off of that statement from Dr. Galani and says, what is the point of masking or protecting a 5-year-old when the likelihood that they will get very ill from COVID or that they will give it to somebody else is pretty low?
Well, I think that, again, is a very excellent question. And to follow up on what Dr. Galani said, certainly, even with younger children, we really can work with them in terms of empowering and to their level of understanding about wearing masks. And this is where also I would like to point something out, and I know Dr. Poole is on the call as well, that we cannot give a guarantee that a child of any age will have an excellent outcome from COVID. COVID is really a virus that is very unpredictable in all age groups. And while last year our experience was that fewer children were hospitalized and severely ill from COVID, we're seeing more kids hospitalized now with COVID. And certainly we are seeing MISC, which is the multi-system inflammatory syndrome of childhood. So I think we have to correct the misconception that all children will do well with COVID, because some children will not do well with COVID. Some children may be hospitalized and some children may develop MISC. Now, we've had at least 108 or more cases of MISC in Alabama. And I had an infectious disease doctor tell me that he had admitted 6 kids to a major medical center with MISC last weekend. Further, we have now seen data that indicates that somewhere between 6 to 10% of children, and possibly more, can have long COVID symptoms. And long COVID in children can be, for example, chronic headache, chronic fatigue, inability to concentrate, And I think when we look just at those three symptoms, not counting potential shortness of breath or palpitations or muscle aches, but a child that is tired, a child that has headaches, a child that has trouble concentrating, that's going to affect their ability to perform in an academic setting. So that's why I think we have to go back and remind parents that kids can have severe outcome in COVID. Kids can be hospitalized with COVID, and kids can have long COVID. And if we look at it in that context, then I think that really helps us to understand that we need to try to prevent our children from getting COVID. And then also the risk of passing COVID to other people. Dr. Hotez last week from Texas was speaking on a call that I was on and reminding people that really when we look at COVID-19 now and we look at the Delta variant, people can infect between 2 and even up to 8 people with COVID and not even know that they're infecting someone else. So I think we have to look at it in context of not only children could have less optimal outcomes, but again, the numbers of people who might be infected by children. Children can spread COVID without actually knowing it. And that could be that diabetic, that person that's on chemotherapy, that person that's had a solid organ transplant or is on another immunosuppressive agent. Thank you.
So kids, and again, this might be something again for Dr. Poole, but are kids able to spread COVID, especially this very contagious Delta variant? Are kids able to spread it at the same rate as adults? Is that what data is showing, or is that what data is suggesting at this point, Dr. Landers?
Yes, there's been a lot of discussion on this, and especially to really quote some of the infectious disease doctors that I've heard, this virus this year is not last year's virus. There obviously are some differences in the variant that we're seeing, the Delta variant. And while previously we thought that children in a younger age group, maybe under 12, were not quite as efficient in spreading COVID, I think now we have seen that, yes, kids can spread COVID more efficiently than we thought. And specifically, when you look at kids 12 years of age and above, they're just as efficient spreading COVID as adults are at spreading COVID. So again, I don't think that we need to have a false sense of security about children's ability to spread COVID, because they absolutely can contract COVID and they absolutely can spread COVID to other people, especially considering the Delta variant that has a higher viral load.
You said that this virus is not last year's virus. That's a quote we've heard from several people across Alabama, several of our very trusted health leaders who have really been out front of this throughout the last year and a half. That also piggybacks on something that I believe you, Dr. Galani, said, and that was, I said this last year, and since then I've changed my phrasing, or I've changed my mind. And that's something that people don't say, I don't think, enough, is that this has changed. I've changed my mind on this. And even with you, whether you change your mind or not, the science has developed to a point where this is true. This virus is different in ways than last year's virus. So Camille, you are around kids all day. I say kids, I mean kids, teens, not trying to offend any of these teenagers out here, but you are with them more probably than most of us. And they are dealing with this change of information, this development of the Delta variant, that they are getting sicker more, and they're getting more sick than they were in the beginning. So how are you seeing your kids in schools handling that fact?
Well, again, like I said before, it does create a level of anxiety and concern. The wonderful part about it is that they're in school and there's consistency there. We're making sure that we are using safety precautions, and there's an opportunity to talk about their feelings and talk about and have the questions answered with as much information as we have available. Because just like Dr. Galani said, we're pivoting constantly. And as the information becomes available, we're able to share it, but then things might change tomorrow. And so we're adults and we're mature enough to be able to say there's certain things that we might not know right now, and we'll try to get more information at a later date. But the students are managing the best that they can. And when it becomes difficult, they have people to talk to. They have school counselors. They have myself. They have other educators who are there to support them. And so that system of support really is a saving grace for all of our students here.
Do you think that they're handling that changing information better than adults are?
Well, I think kids, kids are a lot more flexible than we are. And it's easier for them to pivot. And so a lot of the students are really happy to be back in school and able to socialize with their peers. And so they want to do whatever it takes to be able to stay in place and continue to come to school, because virtual school just did not work very well for a lot of our students, especially younger, K-5. A lot of students just weren't able to socialize and come to school to get the things that they needed social and emotionally that they couldn't access virtually. And so that's actually motivator for students to do what they need to do to stay safe and keep the communication open and ask the questions, and hopefully we'll get the answers, if not today, then when the information becomes available. So keeping that line of communication open and available to students is really what we're relying on right now.
What have been the most, I guess popular is probably not the right word, but the most common concerns that you have heard from your students?
Just I don't want to catch COVID, just the students not really being sure how it will affect them personally as individuals, but then they also don't want to spread it to people in their communities and families. And so for that reason alone, they're really being compliant with the mask mandate and making sure they use the hand sanitizer, whatever they need to do to try to stay safe and maintain the safety precautions that we have in place.
Dr. Galani, is that surprising to you that the kids, kind of like you were just saying, they do it more for social responsibility, and they're a lot more responsible than maybe a lot of adults give them credit for?
Right. So yes, definitely they are doing it more for those social reasons. And as Dr. Landers pointed out, that last year COVID, not many kids were getting affected with it. But what we have seen is a sudden shift, or at least what I have noticing is a lot of the kids are getting infected. Like in my practice every day, I'm doing a virtual visits with them, and half of the kids almost are saying that, hey, they're at home because either they got COVID or their friend got COVID or somebody in their class got COVID. So the number of cases that we are encountering or we're seeing in kids and teenagers are really, really high than what it was last year. So now there is a sense of fear in them that, hey, I want to continue in-person school because I don't want to get COVID. So I think they are getting more careful. They're making sure that they're wearing masks, and they're wearing masks correctly. And in fact, I'm seeing so many kids like correcting each other, saying that, hey, pull it up. So they are more aware, and they're taking this responsibility because they now know that if everybody doesn't work together, this disease is not going anywhere. So it's not just individual responsibility. I think it's a community's responsibility. We all have to come together to do the right thing in order for us to get rid of this COVID.
It sounds like almost an extreme version of what would happen like when I was in school. If one person misbehaved and everybody lost recess, or one person did something they shouldn't do and everybody had to run an extra lap at PE or something similar. It kind of sounds like that same type of motivator on obviously a much bigger scale.
Definitely.
Now, Camille, this is a question that I got on Twitter, and this is from Janie, and I'm going to spin it a little bit to ask you what you've seen in your school system. And she's questioning about if there is enough help being given to schools and school nurses, school staff, and teachers to appropriately keep the adults in the school safe. So I know that you probably can't speak on the funding or what's being done at a statewide level, but what have you seen in your schools? And do you think that your staff, your teachers are being given what they need to be safe?
Yeah, I think we are well equipped to maintain a level of safety as best we can here in the schools. We do sanitizing every evening with the janitorial staff. We have access to hand sanitizer and masks as well. And so we have what we need to maintain safety here at the school. And it's a matter of just encouraging students to, like Dr. Galani said, keep your mask up above your nose and below your chin. And so, yes, we have what we need. And it's really a matter of us staying focused on what's before us and focusing in on the factors that we have available to us, which is the safety precautions as well as whatever information that might change. We're just trying to stay abreast as well as we can.
Dr. Landers, another question that I received, I believe this was on Twitter from Emily, and she says, when will school nurses be able to give COVID tests at school? Again, I know that you are not a member of the Board of Education and you work for the Alabama Department of Public Health, but do you have any insight as to when we can expect that, or if we can expect that?
Well, certainly we know that UAB has been coordinating a grant for in-school testing for surveillance in certain schools, and really schools are eligible to become involved in-school testing if they, wish to do so and are able to coordinate this with UAB. So I think that in-school surveillance testing is really a very important part of being able to keep kids in school. Now, granted, not all schools have the resources, not all schools have enough school nurses, and we all know that school nurses, well prior to COVID, had a full-time job taking care of kids who had other health problems such as diabetes or asthma, or making sure that kids had their ADHD medicine or other regular medications. So again, school nurses were fully engaged prior to COVID. So I think that the answer to that is to work with the school and the school board to see if the school is able to enroll with UAB regarding the in-school testing surveillance. And again, this is testing for kids on a weekly basis in a certain group, a certain population, not necessarily if a kid is ill getting a COVID test at school, although that potentially could be arranged on a case-by-case basis, but really surveilling the schools so that if you have mitigation standards such as mask, social distancing to the extent possible, the environmental cleaning, respiratory hygiene, good hand washing, and then add a surveillance piece in there, then you're more likely to be able to keep kids in school because you are monitoring what is going on in that individual population as far as transmission. So again, that opportunity is out there, that opportunity is available. Several schools are getting started signing up for this and getting involved in this. And again, it's really important to look at the resources that are available for the school, because not all schools have staff to be able to support this. So it really has to be supported through the UAB testing initiative.
That's very interesting. And you talk about school surveillance, and we know that our schools are controlled on a local level. There is no statewide mandate for schools. Schools are making their own decisions locally. That's something that I think bears repeating. But and this is, I think, probably a question for all of you, Dr. Landers, or start with you. But I had several people send me similar messages of saying, how does it make sense when my kid is in school and comes home with a note, or maybe they do it virtually these days with an email, saying that a classmate has lice? I get notified for that. Why am I not getting notified when a classmate of my child has coronavirus?
Well, of course, as you know, the Alabama Department of Public Health developed school guidance this year, which remains consistent with the CDC, the American Academy of Pediatrics, and other expert organizations. And what we have really asked all schools in the state of Alabama to do is please review this school guidance. Please follow this school guidance for consistency in the school setting. And just remember something that I think, because of the scope of coronavirus and the overall numbers of cases, is that maybe persons have forgotten this is a notifiable disease, and this is a notifiable disease that has preventive measures and mitigation measures associated with it, just as with other notifiable diseases. For example, if we had a situation where a child had measles in school, measles is very uncommon now, but we had kids in the school that were unvaccinated, the unvaccinated kids for measles would have to remain out of school, would have to be excluded from school by the school in order to reduce any further transmission. Well, we're talking about the same thing with COVID. We have standard recommendations for isolation of a case and for home quarantine of contacts. So I think it's important, and again, obviously Camille can speak to it from the school standpoint, but it's important for parents to consistently be aware that COVID is out there, COVID's in the community. Now, if a school is universally masking and following the mitigation guidelines, then you markedly reduce the numbers of kids in the classroom that would be considered contacts. Again, there's an exception for kids in classroom. If both kids are universally masked, if there's 3 feet of distance. Again, I say to the extent possible. I'm not going to bring a ruler out there or a yardstick out there, but to the extent possible, you're maintaining that 3 feet of distancing within the classroom. Then those kids that could be a contact to, again, the other kid, well, they don't have to home quarantine. They can monitor, self-monitor, home monitor by the parents as long as they remain asymptomatic. And, we recommend, it's a good idea for contacts to be tested somewhere around 5 days post-exposure. But again, there is an exception there. And that's why we as the Alabama Department of Public Health urge schools to follow the standard practices that are accepted practices by expert groups regarding isolation, home quarantine, and also the mitigation standards in the school. And by that, we can keep kids in school. I, as a pediatrician, am a very strong proponent of keeping kids in the classroom, but we have to do it safely. And that's really where we rely upon our schools to look at our guidance and be able to implement that guidance in the classroom. Thank you.
Camille, same question to you.
Yeah, I agree absolutely with Dr. Landers, and she's definitely the expert on that. And we are definitely following the standards that the ADPH has set in place, as well as CDC. And so because all of our teachers and students are masked, if there is exposure, then the students who've been directly affected, the contact tracing goes into place. So the protocol is pretty clear. And, understanding that, of course, all parents would like to know if there's one student in the building, but that really won't impact the student if we're masked appropriately and using the protocol that's already in place. And so we're doing just that here at Midfield.
Now, have you seen, Dr. Galani, anxiety between kids of feeling like, well, I want to go play with Bobby, but maybe Bobby is sick? Have you seen the anxiety that kind of goes along with that in your kids?
Yes, absolutely. So there is increased level of anxiety, and because kids are all aware of what's happening there. And I think at the same time, their parents are also kind of making them be aware of the situation in a right way. That, hey, you cannot go and play with the Bobby because Bobby's family may have COVID. Or we don't want to go and play outside because we are afraid that you may catch the anxiety, you may catch the COVID. So it depends on the age and maturity of the kid. Some kids are more acceptable to knowing that, hey, I don't want to put myself and my family at risk. But other kids is like, my fun is more important than anybody getting sick. And they may not be at the level where they understand what the extremity of this COVID disease is. So for them, and we know that for kids, immediate gratification is what they want. Like, I want to go and play. Now, it depends on how the parents are handling that situation. Are they saying, no, you cannot go and play? Or they're saying that I understand that you want to go and play, but right now you cannot do that. Instead, how about we play together in the house and do that? So when parents are doing that, that anxiety level is well controlled. But if parents are not doing it, then unfortunately we are in business.
Dr. Landers, you mentioned if there was a kid in a school that had measles, and that's very rare. We've pretty much wiped out measles, and that's probably fair to say because we have a vaccine against it, right? So in that same vein, I had a question, and I believe it was from Mr. Hamilton, and he kind of was posing the question of when and if a COVID-19 vaccination could become a requirement, like our measles, mumps, other shots that we get to go to public schools in Alabama.
Well, at this point in time, we do not expect the COVID-19 vaccine to become a required vaccine in the state of Alabama. We do not expect that to be added to our vaccines for schools. And again, obviously, there's a lot of information on the efficacy of the vaccine, the safety of the vaccine, and we do understand the differing opinions about using the vaccine. And we actually don't have a COVID vaccine right now for anyone under 12 years of age that has been approved, although studies are ongoing on that. But we do not expect the vaccine to become mandatory in the state of Alabama. But again, we certainly want to encourage parents to vaccinate their children appropriately against all vaccine preventable diseases for the very reason you mentioned. I mean, we basically got rid of measles in the United States. And how did we get rid of it? Well, that's, by having a vaccine available. And really, when we talk about controlling COVID-19, the way for us to control this and to get kids' lives back to normal, and really, again, for me, for the future, I care a great deal about what happens with children. I have two of my own making a cameo appearance back here from years past, but I think it's very, very important that we look at the way to be able to control this control this virus. And it will be through widespread vaccination of eligible groups with approved products. So I think that's really what we're talking about at the moment. Thank you.
And you mentioned those your children making a cameo, and I believe that there's an animal making a cameo as well. So obviously that's also where my eye goes. Now, Dr. Landers, too, while I've got you, I got a question emailed to me right before we started this broadcast. It was from Bill, and he brought up we'll call it a case study. I've not had time to vet this or research this, but he talks about children in Sweden where he says that didn't stop attending school, didn't wear a mask, and did not socially distance. And he says, again, I haven't looked this up, that no school-age children there that he knows of died, and only about 15 were treated in ICU. And he says, of that, does that mean that our kids don't need to be masked and socially distanced to prevent COVID-19?
Well, actually, and I've not read that study either, but I would really point to the study that was done at Duke. I mean, there are a number of studies now in the United States that were done in the last year, but the study that was done at Duke by Dr. Kenesha Zimmerman and her colleagues, infectious disease physician, and really a lot of information in that particular study in North Carolina about masking children in the classroom, following mitigation standards, and not really seeing a lot of spread of COVID-19 as a result of those kids being in a controlled environment for a number of hours. As Camille mentioned, they're in school. Obviously, they're only there for 8 hours, but that's a controlled environment that at least we're protecting children during that period of time. So again, I've not read that particular study from Sweden. I have read a number of studies here in the United States, and our studies indicate that, and I think we're seeing now, in the absence of universal masking in the school setting, certainly with this variant that we're dealing with, that we're seeing a lot more COVID. I mean, last year at this time, we were seeing, much fewer cases, and we had weeks, this past few weeks, that we were seeing, several thousand cases of COVID in the 5 to 17 age group. So I think it's very important for us to look at the studies that we have here and say that those studies indicate that with mitigation standards, including universal masking in the school setting, that there is a lot less pediatric disease. But in the absence of mitigation, and kids that are not eligible to be vaccinated, or kids that have not yet been vaccinated, we have seen a lot more COVID. I mean, just to point out, we have had well over 50 kids hospitalized at any given time in the state of Alabama in the last 4 weeks from COVID-19, and that's a significant number. You may think, well, that's fairly small, but it's actually a significant number. We don't have unlimited ICU beds. We're out of ICU beds for adults in Alabama, and we don't have unlimited ICU beds in pediatrics, because in normal times, we don't need those kinds of beds. So I think it's important to recognize that at least right now, we have more hospitalizations in Alabama. In kids, we have at least a third or more of the ER visits, and many major medical centers that cater to children being COVID-19 cases. So I would certainly point more toward Dr. Zimmerman's study as an indicator of what we really could see in our state if we were following all these mitigation standards.
And you talk about at any really given time recently, we've had 50 or more kids hospitalized with COVID. Just for context, how does that compare to, say, a bad flu season? Is that more kids than would typically be hospitalized with the flu?
Yes, it really is. And again, also keeping in mind that, at any given time in the last year, we were seeing single to double digits, low numbers of kids being hospitalized in fairly low percentages. And we're still certainly not as high as we are in adults. But again, being aware that we've had instances in weeks that we've had 5 to 6 to 9 kids on ventilators in the state of Alabama for COVID. And again, that number can shift and change, but when we have children that are requiring respiratory support and progressing to the point of having ventilatory support, I mean, that's very, very severe. And this is what I continue to remind parents as a pediatrician. We don't want our children to get COVID. So let's do all we can to, again, cocoon those that are younger, that can't be vaccinated, to vaccinate those kids that are eligible, and to follow the mitigation standards, especially reminding us that it's very important to support our schools in everything that they are doing to keep our children safe and in the classroom.
Dr. Galani, we've been talking mostly about school age kids, but just quickly, I want to ask you about our little ones, our toddlers and our kind of pre-K kids. Is the masking, is the constant talk about COVID, is social distancing, is that something that you believe will affect them, especially long-term, or is that something that's scary to them? Or do you think at this point, they just think that's how life works?
So that is an interesting question, and a lot of my parents ask me that question. Is like, hey, we're asking 2-year-old, 3-year-old, 4-year-old to put a mask and keep the mask. Are we scaring them? Are we scaring them enough where they feel like, hey, this is something? And especially if you have I have a 2-year-old, and it's like year and a half has been in COVID. So what is the long-term outcome of this? And we don't have studies to tell me what's the long term outcome. But what I know for sure is the development of the kids. So if if they see that everybody around them is wearing masks, it kind of becomes their normal. It doesn't feel like, hey, I'm the only one with mask and everybody around me is not wearing it. Then there is something more like a social outcasting, and they have a different impact on that. But if everybody is around them is wearing masks, that becomes the normal. And I don't think there is any psychological negative outcome from that. So, no, to answer your question, no, there is no negative psychological outcome of asking our little one to wear a mask. In fact, to comment on Dr. Landers, that some studies may show that the kids, and again, from the other studies that it was done in the Scotland, the way I help my kids and parents to understand is like, hey, the numbers may be low, right? But do I want to see my child in ICU on the ventilator? It may be like 1 in 1,000, but there is still a possibility. Being on a ventilator versus wearing a mask every day, I think wearing a mask every day is a very simple thing to do. I might rather want my child to do that than even thinking a possibility of them being on a ventilator. So we need to understand that no matter how the numbers are, the simple measures can save life. Why should we not do it?
Camille, are you seeing the same things with your kindergartners?
Yeah, you know what, the little ones actually, they do a really good job of following directions. And I mean, you can have as much fun as you possibly can with it, reminding them to wear their mask the right way and be compliant. And so at the elementary school, we're seeing really good results from the young ones being compliant with wearing their mask, washing their hands, using the hand sanitizer, just as well as they're able to stay in a straight line going down the hallway. And so there are opportunities to take these moments to teach them skills that they already need to build on as kindergartners. So we're having a really good rate of success with our young ones here in Midfield.
Again, it can be said that the youngest kids follow the best directions and handle it a lot better than the adults do. So Dr. Landers, Dr. Galani, Camille Underwood, thank you so much for all of your insight today. This was fascinating. And I know a lot of our viewers are so thankful to get some of these questions answered. Thank you all so much for taking the time. Everybody watching, thank you so much for your questions. Thank you for Dr. Poole, for you and your medical expertise here as well. Remember that you can join us next Wednesday again at 11 a.m. for part 2 of our COVID Town Hall series, again presented by AARP of Alabama. We'll see you next week.